Hello everyone, welcome back to this channel. Thank you so much for tuning in, and thank you so much for loving Grapham Academy and for staying tuned in Grapham Academy. Okay, so today I want us to look at a course unit that's called Anatomy and Physiology, and what we are most interested in under anatomy and physiology are some of the diagrams that we have before us. So you find that this diagram is got from a specific part of the body, and that is what you call a hand. Okay, so you find that this is got from a hand, and then you find that in our anatomy we have been told that a cell is the smallest unit in our body, whereby when so many cells come together or join together, we get what we call a tissue, and then a tissue join together. So many of the tissues join together to give us a for us to get an organ, and then so many organs come together to give us what we call to give us an organ system. Okay, so you find that you know all that, and we are not going to focus much on that because that is like an introductory part to anatomy and physiology. Anatomy, some people do it alone, like as anatomy. Okay, so you find that on the tissues we have different types of tissues. Okay, we have epithelial tissues, we have connective tissues, and other types of tissues. I'm much interested in what we call a connective tissue because what is presented before you is part of the tissue. Okay, so different cells, or so many cells come together to form a tissue, and a connective tissue has different parts or different examples. I can call them types under it, where we have the bones or the bone, and what we are looking at is a bone. Okay, and then we have muscles and we have blood. All right, so you find that blood is the liquid form of a connective tissue, and then others are not in liquid form. As you can see, a bone is not liquid. What you are seeing here is a bone. Okay, so you find that bones make up what we call a skeletal system, and then we can combine muscles and skeleton to say a muscle skeletal system. Okay, so you find that a muscle skeletal system is where you study about bones, and then you study about the different muscles that are found in those different bones that you have in your body. So you find that in our anatomy, it tells us so many bones exist in your human body. However, we want to look at those bones one at a time. So we have what we call the upper limb, or the upper section of your hand. Okay, or your body. Yeah, so you find that the hand, we always call the whole of this section a hand. All right, however, it is not, the whole of it is not a hand. You find that this is divided in two sections, and those sections, you have this, we call it an arm. Around this region we call it an arm, with of course other tissues, like other muscle tissue covering our bones. You know, we don't walk with our bones open like this, isn't it, guys? Yeah, so this other part we call it the forearm, and then this other part we call it the hand. All right, so when we have the hand, we have the forearm, and then we have the arm. So our topic today, we want to look at what are those bones called that form the forearm. How do we call them? How can we address them? Okay, so here we have so many different types of bones. Okay, we have so many types of different bones, and we want to start right from up. Like I said, this is from the right hand side of your body when you're standing in anatomical position. Currently our bone is placed in anatomical positions, like somebody standing here. So you find that this bone is the bone that you always see. Okay, like you can feel it at your upper arm, or you can feel it next to your neck. Okay, this is what we call the clavicle bone. This is what we call a clavicle. I hope you people can see. Let me see how we can see it properly. I'm trying to make sure that we all see how the bone looks like. So this is, we have turned it behind or backwards. Yeah, so we have other words that we may use for back, in front, and what. So I may not use most of them since we are just starting on bones, but we shall get used to them. The anterior view, the posterior view, like behind we call it posterior, and then in front we can say anterior. Okay, so this is what we call a clavicle bone. All right, so you see that because it is from the right hand side of the body, we call it the right clavicle. Okay, so that's how a clavicle looks like. Next to the clavicle, we have something interesting, and this is what you can feel at your back. Okay, so this is what we call the scapula. This is what we call the scapula. Okay, and since we are getting it from the right hand side, we can see how a scapula looks like, both posteriorly. This is behind. Okay, this is how it looks like from behind, and then this is how it looks like from in front. Okay, that is how your scapular bone looks like from in front, and then behind it looks like that. All right, so after that we have what we call the humerus. This is the humerus that you find in the forearm. Okay, where most of us like to grow the muscles, like those different exercises you people do. So you find that is a humerus, and it is called the right humerus. Okay, you can be given a picture of this and asked to identify the different bones. Okay, so you have to be very attentive, don't doze off, so that you don't fail your exams. At least you need to get something for your exams. All right, so after this, after the humerus, we have what you call this other bone. We call it the ulna. And then we have this one next to the ulna. We call it the radius. Okay, when you're standing, that other bone, that your lateral view, or the, can I say the last side, not closer to the stomach. You people, it is the lateral part of your body. You get a radius, and then or radius, depending on the nursery school. And then we have the ulna, which is medial, like closer to the midline. We have so different lines when you're standing in a anatomical position. We have what you call a midline. Okay, so this is a midline. And then we come to your beautiful hand, the hand that is doing most of the work. Okay, so the hand has so many bones, and then just the hand, we can have like around more than, I can say, 20 bones. Okay, so you find that right here we call them carpals. Okay, so you find that this is a carpal bone. This is part of it, just here closer to the radius and then the ulna. Then we have these other ones, we call them metacarpals. From the word carpal, we have metacarpals, not carpals, members. I hope you're hearing me right. Yes, we have metacarpals. So this is the second metacarpal, this is the first, this is the second, and then this is the third, this is the fourth, this is the fifth, because you have 5 fingers. Okay, and then after the carpals or metacarpals, we have carpals, metacarpals. You find the carpals alone are around 8 of them, and then the metacarpals are 5 that we have already seen, and then we have phalanges. Okay, these are phalanges. So phalanges, when they are far from the carpals, we call them, okay, when they are near to the carpals or the metacarpals, or near to your forearm, we call them proximal. Okay, like they are near, and then when they are far, like this other one, this tip, we call it distal. Distal is like far away, proximal is like closer. Okay, so we have both the proximal, those that are far, and then we have what we call the medial, those that are in the middle. Let's try to check in our hands. We can see those different 3 sections in your hand. And then these are the last one, we call it the distal. Okay, so that's the medial. We have the distal, the medial, and then the proximal. So we are not looking much on the bones and their names. We just want to know what the general names are. So you find that here alone we have a number of bones that at least you need to know where they are, where they're located, how they look like. And here we are. We can easily see how they look like. We can even have this, the humerus, we can see it, the radius, the ulna, a couple, the metacarpals, and then proximal, something like that. So we need to appreciate that God has created us great, and then we need to know what do these bones do. These different cells that have combined together to give us this wonderful tissue, what does it do in the body? Okay, thank you so much for listening. I would like to end here for today. So these are the bones of the upper limb. This is how they look like. These are their names. In the next lecture, we are going to look at the different parts of each bone that we have seen in the upper arm. So before you watch the next video, endeavor to watch this first, because it is in a series form or it is in episode form. One leads you to the other. After we have looked at the different parts of these bones, we shall also look at the different muscles that we find in these bones. Okay, and then after we look at the different muscles, we shall look at which nerves can we find in this. All right, so you find that for a system to be formed, you need a combination of what? Tissues. So if you have a nervous tissue, and then we are having the musculoskeletal, or the muscles and the skeleton going to the connective tissues, as well as the blood vessels are connective tissues. So you find that the whole of that becomes an organ system. Thank you so much, guys, for listening. Subscribe if you're new.